Nicola Hill joins us now from London with more on this. Nicola, what effect is the lockdown having on teenagers?
Well, the whole point is we don't know the long-term effect on teenagers, which is why two studies are being carried out by universities here in the UK. And they're surveying 2,000 teenagers over the age of 13, between 13 and 24, actually. They're going to be asking them how they're feeling at the moment, and those results should come out in a week or so. But then they're actually going to follow this on a long term basis. They want to know whether the impact of school closures in particular is going to have a major impact on their psychological and mental health, and the fact that they can't socialise with their friends in person. Now, I've been speaking to a child psychologist, Dr. Nick Jarrett, who says it's vital that parents keep a lookout for any effects this lockdown's having on their teenage children. With girls, he says they tend to internalise, they might become quieter than usual, stay in their bedrooms, perhaps they don't want to get dressed or put their makeup on or anything like that, whereas boys tend to externalise, they can become more aggressive and they can act out. Also, to look out for signs of self-harming. And as you just said, Rachel, the other fear he says that people have to be careful of is whether teenagers are being groomed by sexual predators or whether they're being bullied online. And The Lancet has published an article talking about teenagers who already have mental health problems. And there's fears that these will become much worse because they've lost the structure and the support that they usually get at school, particularly teenagers with autism or ADHD who like the regular routines. And a psychologist in Hong Kong in the article is saying that, again, they need to look out for teenagers who are just staying in bed, they're not getting washed, they're not getting dressed, they don't really want to eat anything like this. And this, of course, is something that is concerning people worldwide. The United Nations is worried about girls in particular in parts of Africa. They might not have access to the online learning that other teenagers have in wealthier areas, which means that when schools do go back, they won't stay at school, they won't return to school. And it's known that with girls who have dropped out of school, they're twice as likely to become pregnant and to give up on education altogether. So there's a lot of concerns about the long-term impact on teenagers.
Yeah, a lot of concern there and a lot for parents to be worried about. What are teenagers themselves saying?
Well, I've spoken to some teenagers here in the UK and to their parents. Now, I spoke to Bella, who's 16, and it was interesting. Her one positive about lockdown is that she says she's able to study better because she's not being distracted. But like all teenagers, she's missing her friends, and she in particular is missing her boyfriend. Last week, they had their 6-month anniversary. Only teenagers have month anniversaries, but he left chocolates and flowers on her doorstep, which I thought was lovely to hear. But she did say that she's noticed that her step count has gone down by 70 to 80% because, of course, you're allowed out for 1 hour a day to exercise here in the UK, and it's just not enough for her. So she's concerned about that. I also spoke to Kathy, who has a teenage son. She's doing what Dr. Jarrett suggests. She's making sure that they do as many family activities as possible. She says her son is definitely benefiting from the online learning. It's enabling him to keep his studies going. And she said also the one benefit she's noticed that he's begun reading again, because we know that teenage boys tend not to read novels, and apparently her son ordered one book, enjoyed it, so he ordered another 6, and he's cooking with her. And he is exercising, he's doing weight training. And we actually are seeing on social media some lovely stories about teenagers helping the community. They're volunteering for the elderly, and even teenagers studying product design have started making face masks for care homes. So it's not all bad news, but as I say, we don't know the long-term effects. And psychologists are saying that we also need to take into account those teenagers who are being bereaved, those who have lost relatives that they've not been able to see, or even parents.
Yeah, certainly. But
Yeah,
it is
certainly.
good to know that there is at least a bit of good news and a bit of hope in there. Nicola Hill, thank you.